Okay, welcome everybody. My name is Gavin Quinnis, and I'm one of the founders of US Health Center. We're going to start our next installment of our HealtheBeat program, which is a showcase opportunity for our clients and partners that we're working with to discuss how we work together. And I'm blessed to have Governor Thompson, former Health and Human Services Secretary, and a great cast as a member of the Stay Healthy team. So with that, I'm going to turn the audio over to you, Governor Thompson, and please go ahead and take us away, get us started.
Well, first off, let me just thank US Health Centers. You're a great Wisconsin company, and your founder, Dr. Raymond, is a good friend. And Gavin, you have taken it to new heights, and I congratulate both of you because you're in a space that really interests me, and that's how do we prevent disease and how do we improve the quality of health for all Americans. So let me start out by saying thank you to all of those on the line. I appreciate very much you being involved because you individual social service directors and individuals that are looking at helping your employees, this is a great program for us to work together to improve the quality of health of all Americans. I'm absolutely honored to have been invited to introduce to you the products and the services of Stay Healthy, a company that I chair, as well as United States Health Center, US Health Center. It's in Thiensville, Wisconsin. Well, serving as Wisconsin's Governor and Secretary for Health and Human Services, I saw firsthand the increasing cost of healthcare and the impact on our gross domestic product, individual lives and companies. And many of our companies were being impacted in ways that diverted funds from salary increases and innovations and only to cover the cost of health premiums, which were going up at an alarming rate. We spent a great deal of time researching what were the primary drivers of these trends and how best to address them. It became obvious to me that the increase in body fat percent was a real problem. My Surgeon General, Richard Carmona, stated that it was a cause of illnesses, including type 2 diabetes, many cancers, strokes, and heart diseases. Our department issued a call to action when I was Secretary of Health to address the epidemic of excess body fat and associated diseases in America. We included statements such as the biggest terror threat in our country is not terrorists, but excess body fat. We also stated that the future generations being born would be the first generations to not be able to achieve the same age of their parents. This remains as true today as it did when we sounded the alarm back in the early 2000s. It was at this time that I was introduced to Stay Healthy, a company that now I'm the chairman of, which focused on measuring body fat, lean mass, and hydration, and providing wide access to consumers for tools to do so. I was impressed by the company's direct commitment to quality and prevention. In fact, we installed one of their kiosks at our headquarters in Washington, D.C., where people were able to measure and store their results after screening for blood pressure, pulse rate, body fat percent, lean muscle mass, hydration, and weight. The kiosk was extremely popular, and the fact it was web-enabled and results stored over time was very, very well received by my employees. The fact that Stay Healthy also had handheld devices, which were used by physicians around the world and clinically overseen weight loss programs, which were very impressive. When combined with their activity monitor, which was setting the gold standard for tracking steps, distance, and the calories burned accurately, and was used by researchers worldwide, it became obvious the company was committed to clinical and medical excellence. At the same time, I became aware of another great company, which I'm very proud of, and that's US Health Centers. A lot of you know about that company and are involved with that company. Their commitment also to providing medical screening, information, and ability to predict outcomes was clearly a valuable service. Now, as Stay Healthy launches their new services using the convenience of the mobile world, I am very proud to introduce as Stay Healthy's chairman the team from Stay Healthy and U.S. Health Centers, so you can see why I am so passionate and so committed to these companies. I hope you enjoyed the introductions. I hope you enjoyed the program, and I hope we have lots of questions at the end. With that, I turn it back to my friend and the individual person that is leading U.S. Health Centers now, and that is Gavin Quinnis. And thank you again, Gavin, for being on the program.
Oh, my pleasure, Tommy. It's great to hear the passion in your voice, and of course, that's probably one of our greatest strengths is the passion in what we believe in. So, as it is a standard installment of this HealtheBeat seminar that we do, I'm going to run through our standard model and then turn it over to John. Let me just click through some slides here. The thing that is most driving us, of course, is our mission statement, which is to improve health and reduce costs by industry-leading science, technology, and advocacy. We are blessed to work with over 1,000 different employers in the United States and across the world. I'll just throw some statistics up here that I think are germane. Those clients reside in over 6,000 different locations. We have over 500 different engagement plans that are designed and implemented in our deployment. So super high focus on personalization, both at the work site and with the individual. We have over 20,000 healthcare providers that use our PredictIMed platform as part of their day-to-day life. I think one of the things that is really interesting in our model is not just the ability to save lives, but the ability to reduce costs primarily through preventing the catastrophic claims that tend to blow up the health plan, both at the person's quality of life as well as the employer-sponsored plans. Lots of different clients in lots of different industries, primarily healthcare, insurance, brokerage, as well as a number of competitors that use our solution as their primary back end. In addition to that, 4 things that people tell us are different about us that they have coming back is our PredictIMed validated analytics and predictive modeling tools, our ability to reach out and touch anybody in North America and sometimes overseas with our screening and laboratory services, our fully integrated technology suite, which is very broad and very deep, as well as our ability to engage people in a very different way through our holistic coaching. And we'll touch on a few of these as we go over the next 15 or so minutes. So this is the model that we've been chasing since the very beginning of our inception in 2003, and that is to get ahead of disease prior to the appearance of symptoms. Of course, that coincides with not just cost, but also quality of life. So catastrophic events are really the driver of a vast majority of our insurance and clinical activities in this economy. The Journal of Epidemiology came out with this diagram. We actually were drawing this on the board for many meetings beforehand, and they also talked about this thing called the 4 Ps. We kind of look at it backwards. The whole model of engagement has to be the primary driver. So how do you get people to participate? You have to make it, what's in it for them. You have to personalize the engagement, and that really means helping to understand what you're preventing, which could be the first condition that unfortunately we're all going to face at some time in our life, the worsening of an existing condition, a related comorbidity, or something completely unrelated. And that's all driven by the ability to predict. And so I'm going to take you through our 6-step model here very quickly. The first is identifying risk. And what we've been able to do, and Dr. Gavery is the genius behind this, is using a process called synthesis analysis. So understanding what are all the different studies, what does the literature say, the universities, the organizations that are focused and steeped in science and research about the causal effects of disease. And so we've knitted together a giant analytics stack with our artificial intelligence tools to understand what the world thinks causes disease. Much like when your primary care doctor goes to school, they learn about all these things, and you hope that they understand how to deploy it And we also know that the data all comes from a number of different silos, whether it's genetics, demographics, physical measures, and blood and other types of chemistries, your lifestyle, and your medical history. Those are the markers that persist. And if we gather the right data, we can truly predict what's going on and what's going to happen with those individuals. We focus on over 75 conditions and lifestyles, again, based on over 25 years of research. Predictive modeling is the only company that has been validated from a third party. That third party is the Validation Institute, which was created by Intel and GE. You can read the documentation here in the press release that they put out in 2014, that they had an opportunity to analyze our predicaments, ability to identify and reduce risk, and reduce ER and hospital visits by 80 to 93%. That's an astounding number, and really it took us decades to get to the point to have enough cases where, unfortunately, we predicted that somebody was going to get something like depression or back problems or a variety of cancers or metabolics like heart disease and stroke and diabetes. And unfortunately, the culture was such that they didn't act on it and they ended up with that condition. So there's a failure rate analysis. Over 15,000 cases that we tracked backwards over 5 years. So that's really important to our ability to then personalize the information and change the conversation from things like you shouldn't be eating and drinking and smoking and sleeping this way, or better do it that way, to all of these things have now coalesced within your system that it's leading to this particular disease, and this is why you ought to take action. It changes the conversation significantly, and it creates a different kind of engagement with the providers, of course, because they're speaking their language, and the CFOs, of course, because they're writing checks for conditions that have erupted in the population. The second part of our model is identifying the future costs, and it's very interesting the amount of work that our team has done here. And we know as practitioners that the average amount of spend in the U.S. economy is around $8,000 to $10,000 a year. So if we're good at predicting the clinical aspect of a health, are we also then able to predict the financial impact? And fortunately, we are able to. I'm going to click through these couple of slides here and land on this one. That is an example of a report card in our reporting that illustrates these are the number of cases within this population. This is the risk burden, that is that future element of cost. Therefore, we can set priorities around this population and where do we work to reduce the total cost by intervening ahead of time and preventing these diseases from either occurring or bringing them in for a softer landing. How do we change potential stage 4s into stage 1? How do we change a potential CABG or a chest crack or a interventional cardiology event to maybe a pre-scheduled angioplasty that allows a higher quality of life and a lower cost? What we have learned over the years is that our book of business range is around $6,000 to $12,000, bracketing that average spend of $8,250. So we know that we're in the ballpark, and therefore we can set intelligent priorities that are culture driven. Do we make decisions about chasing these 191 hypertensives around at a savings of about $2,000 a case, or do we focus our energy on getting these 24 people to prevent colon cancer at an opportunity of about $80,000 a case? This presents the opportunity for making fact-based decisions in healthcare. The third step in our model is managing the predictable. This is where a consulting team goes to work, either interpreting or preempting with the information, custom designing and assigning your coaching team that works with you, understanding what your objectives are, how might your culture benefit, what can we do from leveraging what you already have in your culture, whether you're a captive, whether you're a low type of insurance plan like a MEC plan, or whether you're a highly sophisticated employer with all sorts of different bells and whistles in your benefits. We can help customize it to meet you at your cultural need. What we do know is we don't do the same thing for the salespeople that are working out of their home in the mountains as we do for the people that are at the headquarters that may have a fitness center and a cafeteria. So that's critical. That's all about the personalized predictive health. One of the big elements of this is changing the way that we deliver advocacy, or in our model, holistic care. And we do spell that word that way because we aren't managing the disease, we aren't managing the lifestyle, we're managing the person. and that particular condition or lifestyle goal is something that permeates just one category. Obviously, the whole linkage of mind, body, spirit is germane to everything that we do. So what we did in 2004 is recognize that we needed a center point of contact, much like the primary care provider in our life deals with our treatment. They may not be the one running the equipment or handling the surgery, but they're the ones that are quarterbacking our care. So our holistic coaches, which are all RNs, and many of them are clinical case managers, quarterback your care, whether that's helping you prepare for a marathon and you're completely healthy, or helping you quit smoking, or helping you prevent a cancer, or understand how to communicate with your physician, or how to help with you with your family in discharge planning, or anything associated with pre-certification or anything like that. That coach is your advocate. They're your contact. We don't use call centers. Our coaches make appointments with you and follow up. Highly, highly effective. Obviously, we have all sorts of communication in our healthy communication material, whether it's pinging your app, whether it is communicating with posters that are on the wall, or everything in between, weekly type of communication. We develop a communication plan that reaches out and touches your individuals and relates it to your insurance offerings and connects them to the coaching and the opportunities that you have that might be resonant within your culture. One of the things that we've done different this year that might be new to you that have known this for a number of years is we've created a workshop we call Finding the Way to Your Why, and we've developed strategies around every one of these conditions. So in the old world, what we typically did was assess the data, gather the data, understood the strategies, and then deployed solutions. And we've reversed that model this year with many of our clients and said, we already know that there's going to be back problems or cancer risks or mental health issues or other areas like that in your population. By the time that member talks to your coach and we launch the program, we absolutely want to make sure that all the posters, flyers, communication materials, engagements with other providers that might be in the program, like maybe on-site fitness or an EAP or things like that. We've knitted all these things together into an offering that is culture right. So when that member gets on the phone or logs into their app, everything is custom to that culture that is in that organization. So we have dozens of these kinds of programs around these various conditions as I illustrated here. So the next step in the model is, of course, if everything is working properly, ought we be able to see better health outcomes? Unfortunately, we've got many, many examples of this. This is a study that we did a couple of years ago where we tracked about 4,600 members over the course of 3 years and asked the question, did the risk burden in those populations, that repeat participant population cohort, did that reduce and lower? And if so, by how much? And as you can see in every one of these categories, whether it's breast cancer, colon cancer, heart disease, etc., every one of these is going down precipitously. And that's significant because these are lives that are changed for the better. Sometimes lives that are saved from a surprise stage, 2 or 3 or 4 cancer, or a widowmaker heart attack that was about to change one perceivingly healthy person into somebody that might not be with us tomorrow. The other thing that this study pointed out was that ability to measure that risk, which interestingly came right around that $8,000 number. It's kind of like solving the same math problem from a different angle and ending up with the same answer to check your work. So that's an example of outcomes. I'll talk about a little bit more in a minute. The next element in our model, step number 5, is really constant data analysis. We need a giant technological backbone. I just want to reiterate that every single thing that we're talking about, we've been doing for many years, started in 2003, is very, very robust. And some of these tools are pretty cool. And to the outside world, they're all separate organizations, maybe organizations that only do 1 or 2 of these things. And we work very, very hard to have a complete continuum of care approach so that when we're reaching out with a member, we're not bouncing them around to 5 different departments. When your account manager or health and wellness consultant is on the phone with you, they've got all the data at their fingertips and they know how to take care of you. Whether it's just helping somebody learn how to, re-log in, or whether it's understanding what's going on with your physician engagement. That's critical, and that's why you need a big technological backbone. We have over 12 million lines of code in this stack. One of those features is a claims analytics tool we call the Sweeper. It digests it digests medical and pharmaceutical claim data and analyzes your costs, your gaps in care, physician profiling, and a new science that we're bringing out of understanding whether or not you and your provider are working to prevent disease. Because our system knows what protocols are needed to prevent disease, and of course, if we're digesting the claims data, we can track whether those protocols are being followed. So there's some new things that are coming out in that stack. Of course, the Personal Health Dashboard is our flagship product. This is the portal that faces. I think we are one of the very first organizations to have a portal in 2003 when we launched this PhD, this Personal Health Dashboard. It of course has all of your clinical protocols. It has all of your online learning programs, your library, any educational materials that you need, everything associated with tracking your exercise and your nutrition. It's a one-stop shop. It has all of your medical claims records and all of your vital statistics. So it's really your electronic medical record on steroids in your hand on your phone. The aggregate reporting, you know what that looks like. Lots of ways to visualize the data. Lots of ways to look at the conation or the readiness to change of the population. What kind of strategies should be driven into your health plan to drive down costs, whether that's pharmaceutical or physical therapy or any kind of engagement around your plan design. That's what that helps us understand. We have our own EMR tool we call the Coach Tracker. It is what it looks like. It's like an EMR. It's where not only can we stratify and analyze data, for example, to find out, which of the diabetics are at risk for heart disease, or which of the folks that have a high BMI are at risk for cancer, and how do we then go and attack that? And so that's a really nice tool set that about 20,000 medical professionals are using on a regular basis as part of their deployment with us. Health Counts is a very, very mature, and by that I mean built in 2008. So we have over 10 years of very high touch engagement, whether it's leaderboards and challenges, connecting your devices, working on certain points or campaign activities that yield funding to your health reimbursement or health savings account, whether it's managing eligibility. It's a very, very robust system, and it's become increasingly more of interest in the last couple of years. And this last element, the content manager, is really, it's an internal facing product. But what's interesting, and the reason it's on this deck, is because the way that we operate within our shop is those folks that are your health and wellness consultants, they actually are helping run the production and development of the software for two reasons. Number one, they're the voice of the customer. They know what the market needs. They are engaging with the market every single day. And so we help them get in a position to help us understand the priorities and the strategies that are needed to keep them ahead of the market. But on top of that, it's also a tool set by which they can do a vast majority of the customization without having to run to IT and have something built. So that just makes the opportunity for improvement very, very quick and highly nimble. In addition to that, our client service team, the people we call our health and wellness consultants, they actually have to use this software that is the same that faces our clients every single day to do their job. And I've been fortunate enough to run a number of software organizations, and those things are very different. And it makes the team highly effective, and it's a big reason why the retention is so high. The last element in our step here is, if all this is working, it sounds good, are we lowering costs? And there's lots of ways to measure that. This is actually one of my favorite pictures of cost and outcome measurement, where we can track over time amongst these categories, how are we reducing the pre-disease risk. Now, of course, these people in these categories are anywhere between 3 to 20 times more likely to have this condition erupt in the next 3 years. We have opportunity to compare that to our benchmark. And if we're working on the right strategies with the right focus within our clientele, we are absolutely able to see a reduction in these categories and measure it over time. This is a real life case as an example. We can also track the claim spend and track it over time, compare what we know about the information associated with the dollars and so forth, as well as the total risk burden in the lower left-hand, tracking the overall total expected spend or that risk pool dollar amount, how is it tracking and lowering over time, as well as absenteeism, presenteeism. Productivity is a big thing. On average, we're spending around $400 of payroll per year per person for people that are going to work sick and are present, not as present as they ought to be, or people that are missing work altogether. The next slide, I just want to show a little bit of savings here. This is a marketing view of a coaching report where we are tracking those individuals that were engaged in coaching, how many were at the beginning of that engagement, and now a year later or some period of time, how many cases are still remaining in that risk pool, how much are we reducing risk by case, and how does that aggregate. And of course, we know, those of you that have been with our model for a long time, you know that we say it only takes one life to be saved. It's got to be the right life. It's got to be, that cancer or heart disease, that $100,000 problem, to get your return on investment. So there are many ways in which you can get 20, 30 times your return on investment if you're focusing on those catastrophic cases. Some of those that may not be aware of our newest launch is our PredictIMed self-funded health plan in a box. It's got all the bells and whistles that you would expect from a big box carrier like a Blue Cross or United, but it's all in a self-funded model. It's averaging at the point of underwriting a 15% reduction versus your typical 15% increase, and it's completely engineered to get the members engaged in preventing catastrophic disease and managing risk. And it couples a whole bunch of things that we do with our clients, including stay healthy. So with that, John, I'm going to turn it over to you. Is that correct?
Yes.
Or am I going to turn it over to Kevin?
To Kevin.
Is it Kevin? Okay.
Yeah, Kevin's fine.
All right, Kevin. There you go, my friend. So John,
Kevin, yeah. Sorry?
Do me a favor and introduce the team here, because I didn't get a chance to do that on the top, and I don't want to leave that out unless you're going to do it later.
No, it's okay. I can introduce our team. This is John Collins. I'm the founder and CEO of Stay Healthy. We also have Ziggy Comandel, who is our president, who will be showing you the new technology of augmented reality and how it impacts healthcare with the solutions that we've created. And Paul Ring from Universal Music Group and Bungalow Records, who will be talking about the rewards and involvement of Universal Music Group, who is the largest and most powerful entertainment company in the world. So we have some high-level people here about to show you how we're getting involved with USHC. So I'm going to give you a little bit of history around Stay Healthy. Stay Healthy was founded in 1995, and at that time was intent on providing access to high-quality, medically valid screening technologies. The company executives who were running the company at that time recognized that to be successful, we needed to use the rapidly emerging internet as a delivery and results storage platform. I'm going to go a little bit off my notes here. They built the first desktop web-enabled touchscreen kiosk. They went to Lockheed Martin to build the case, and that case was bulletproof, which was absolutely unnecessary, but it was kind of impressive. In 1998, we became aware of what Stay Healthy was doing and purchased control and set up headquarters in Monrovia, California. We did a great deal of research, and we concluded that the growth of excess body fat, if it continued trending, would have a tipping point beyond which recovery would become almost impossible, with the many associated diseases, which would only get worse and downward spiral would increase. Looking at the technologies available at the time, we could see that making highly accurate, clinically valid screening technology widely available was going to be difficult. At that time, the gold standard for measuring fat was hydrostatic weighing. Asking people to take their clothes off, get the air out of their lungs, and dunk themselves below water was a non-starter on a wide scale. And if you look at that picture there, which is on your screen, I would not want to be that person. Another technology in use was bioimpedance. This method used lookup tables, and those tables consisted of their age, their height, their weight, their gender, and they selected an athletic profile. In other words, Were they a couch potato or were they a professional athlete, and all the levels that go in between? As well as looking at the profile, electricity was at a preset frequency was introduced into the body, either through the hands, the feet, or both. The resistance to that signal was measured and used to modify their body fat percent number, their lean mass, and to produce a hydration number. And what you see on the screen there is one of our handheld devices. We decided that using this technology was the best way to make it widely available so that anyone could use it. We acquired the rights to the technology and decided to conduct a clinical trial at East Tennessee State University, who were leaders at that time in that technology. And we wanted to compare our results to hydrostatic weighing. The results were not good for us. We could see we needed to change our equations if we wanted to give an accurate result. After the clinical trial was completed, and after completing the new equations, we introduced the new ones and applied to the FDA for clearance to be able to market our bioimpedance device, and received that clearance under provision 510K, which you can see on the screen. The acceptance of our handheld device by medical professionals involved in medically supervised weight loss programs was rewarding, and today, nearly 20 years later, there are still over some 3,000 medical professionals using that technology worldwide, primarily in the United States and Canada. We soon realized that giving a person a body fat percent as a number was inadequate. We had to do more. We were asked every time after a person learned what their body fat percent number was, what does this mean? The next question in most cases is, what do I do? Providing an explanation was accomplished through our frequently asked questions section. What a person needed to do was a challenge. We decided to create the tools and give users the ability to track calories, expenditure, set burn goals, and fat loss goals. The focus here was not on the scale, it was on reduction of body fat. Newly emerging at the time were accelerometers. Originally designed for use in airbags for the automotive industry, we found a company in Germany that had created a device for human trials in measuring activity. Using 3 accelerometers, it was large, heavy, and unwieldy. We purchased the rights and downsized the board containing the accelerometers into a pager-sized device. Many of you may not know what a pager is because it's such a long time ago, but what you see on the screen is a Motorola pager with our technology built into it. Once we completed the clinical trials of this device, we again applied for permission to market our system to the FDA. And that system comprised of body fat measurement, lean mass, hydration, and activity. That activity included the ability to record how many calories they were burning, what the activity was, how long it had taken, and that became a very important part of the program. At that time, we were approached by IBM, who had completed their best available technology analysis, and they selected Stay Healthy. They asked if we would be willing to co-design a kiosk that could measure blood pressure, pulse, weight, body fat percent, lean mass, and hydration, and we said, yeah, we'll do that. And the first kiosk was introduced the next year at the National Association of Chain Drug Store Convention in Las Vegas, where it was incredibly hot. Response was excellent, with orders of over 200 placed at the convention. IBM then decided, which proved now it was a good decision, that it no longer wanted to be in the business of selling laptops, computers, servers, kiosk business lines, and we decided we would take over that business. We immediately redesigned the kiosk, and after FDA clearance, set about marketing it. Our first successful arrangement was with Kroger, the largest U.S. retail grocer with pharmacy. That was followed by Albertsons, HEB, and many others. Eventually, we realized that there were 2 main companies that looked like they would succeed in the health kiosk business: Stay Healthy and Higi, that's H-I-G-I, headquartered in Chicago. Higi's chairman, Bo Wrigley, met our chairman, Governor Tommy Thompson. And it was decided it would make sense to merge each company's assets into a new company, now called Higi SH. There are over 11,000 kiosks installed and are screening as many as 2 people every second in the US and Canada. So if you go into any of those stores and you see the kiosk, you know who they belong to. We concluded that to really meet our goals of measure, track, and change in large enough numbers, we had to transition to mobile. The challenge was, could we take the screening devices and activate them on a cell phone or laptop with the same or better level of accuracy? The answer, as you will see when you deploy our technology, is yes. We've learned a great deal over the years, and here are a few highlights of our findings. What do people carry with them wherever they go? Cell phones. Do people carry wearables wherever they go, such as the Fitbit? In most cases, no, they do not. Typical usage is 60 days. We know that if a solution is accurate and convenient, we stand a very good chance of seeing people use it, engage with it, and learn from it. We know that the person's engagement in health can reduce the lifetime cost of health by as much as 30%. We know that the more educated a person is about their body and health, the more they can reduce that lifetime cost of health by a further 30%. We know that anyone engaged and educated about their body and their health will lead a longer and happier life in the majority of cases. Our focus is in several defined areas. 1, measure with clinical accuracy. 2, keep the results. 3, view them over time. And 4, provide engagement and educational tools and solutions. We know that giving a person the body fat percent as a number is not accurate. However, what if we could show the impact of the body fat on their heart, liver, and kidneys, and other organs? What you're about to see is just that. New technologies come along all the time. How could we show a person their body impacted by the amount of fat they have as a whole? The answer is through the use of augmented reality. This is a technology that augments or adds to a reality. We met with a company called Augmently, which had developed a method of augmenting reality and received several patents for their innovations. We saw that augmented reality could impact health in a way that could be disruptive. As a result, we purchased that company and its technology and are now in the process of creating platforms that merge health and augmented reality in ways that have never been done before. The platforms being created and launched cover the following areas. 1, our ColorQuest AR platform and app developed to engage and educate children about their bodies. This is something that sadly is becoming less and less evident in schools today. 2, a puzzle playground platform and app to engage and educate children about their bodies. 3, a body fat indicator which measures body fat percent, lean mass percent, calories burned, footsteps, and distance traveled. And when. We'll soon add food intake through a new soon-to-be-announced technology we are acquiring. I'm now going to hand over to Ziggy Colmandel, Stay Healthy's president and founder of Augmently, Inc.
Thank you, John. Thank you, Gavin. So what is augmented reality? As John said, Stay Healthy is the first company ever to combine healthcare and augmented reality for use by the public at large and not just medical professionals. Let me give you a brief description of what augmented reality is in the simplest form. If you break down the two words, what does augment mean? It's to change or enhance. In this case, we're enhancing our reality, which is our real world, by overlaying graphics, words, 3D models, and/or video onto our real world while looking through the lens of a camera on our smartphone or tablet. It's literally in your pocket. So for instance, what you're seeing on the screen here is someone looking through the lens of a camera on their phone, and they're placing an animated heart in a room that doesn't have it there. Unlike virtual reality, augmented reality does not require any wearables and has global distribution through the world's most widely used platform today, which is the smartphone and its massive user base. The body fat indicator is a game changer. It gives people an opportunity to literally start improving their health by simply using their smartphone and to measure, track, and change personal behaviors that impact wellness. First and foremost, the Body Fat Indicator app is focused on helping people identify their body fat percentage, and when appropriate, you can also see levels of excess fat. The app also integrates an augmented reality feature which allows users for the very first time to see how the body fat affects their organs specifically related to their personal percentage of fat. You will see when the app gives the user a body fat percentage reading, they can then click on an AR function to see how much a particular organ is surrounded by fat externally in contrast to a healthy organ. Let me show you what I mean with an example of how it works with the heart, kidney, and liver. So here you see a person's heart via augmented reality surrounded with fat. This is a person at risk. And now you see as the slider goes down to the healthy heart, they can see how it compares. They can rotate in full 360, enlarge it, get as close as they want. With the liver, it's a bit different. The fat grows from the inside, causing the liver to expand in weight and size. And with the kidney, you'll see here the adrenal glands up top. The kidney gets completely surrounded with fat, which is a big cause of high blood pressure. The purpose of doing this is to make an emotional connection and engage a person in their health. It is one thing to say you have excess body fat, but when you show someone the effect it has on their personal organs, the response is shocking, it engages them, and it causes them to want to take action. Once they see their organs, a user can view where they are on this health spectrum and be given tools to set the right goals to manage their personal health. In addition to augmented reality technology, the BFI has medical and clinical grade technology and components previously cleared by the FDA, clinically validated data, highly accurate real-time monitoring and activity tracking, and is derived from technology being used by thousands of researchers and medical professionals worldwide. We will continue to add value to the app with new features. Coming soon is a portions feature, which will take the guesswork out of dieting. It's designed to help dieters visualize portion sizes using augmented reality and has been developed with guidance from leading nutritional experts. The important fact here is the BFI app works with the user to identify their body fat content. They are told if their fat level is healthy, if they are at risk, or if they are already in trouble. If a user is in need of help, the next thing we do in the app is to work with them to set a goal. For example, a person with 35% body fat is in the at-risk category. The app will recommend setting a goal of 32% based on the number of pounds of fat that has to be lost to reach over a lower percentage. It would also tell the user the time they should take to lose the excess fat in a healthy way. Next, the goal number is set with the appropriate amount of time it will take to achieve it. The app will then explain to the user what their basal metabolic rate is, or BMR. In other words, this is how many calories the body is normally burning daily without any activity. No other app has ever provided this real-time information to show users exactly where they are. In addition to the release of our Portions app, our AR Portions feature, which we already mentioned, there will be a proven highly successful nutrition program. This is not a diet, but a program that allows people to eat what they want in fat-burning combinations that result in fat being lost without any weight gain. I'm not going to speak about Color Quest. A topic that is very important to us is childhood obesity. It is an epidemic that our country is facing that needs to be reversed. We have created an app that entertains children while educating them about healthier food choices, their bodies, and exercise. Our Color Quest app for children from ages 4 and up makes childhood healthcare education fun with augmented reality. When we looked at the kind of apps and activities that have grown to be extremely popular with both children and adults, we noticed that 2 activities stood out, and that's coloring and puzzles. Both activities have apps in the app stores with tens of millions of downloads. You probably noticed when you go to a restaurant that in many cases, they immediately offer children some crayons and something to color. That's because it's proven to keep them focused and is a great way to reduce stress. I'll go ahead and hit play on a demo video now for you to show you how it works. So here we have 48 characters, and that is bodily organs, fruits and vegetables, and other foods. And here you'll see a kid now will get an apple in 2D, and they have different tools that allows them to color in that apple any way they choose. They can choose to use big brushes and color out of the lines. They can zoom in and get as detailed as they want. And again, super fun, super relaxing. We use a voice, which you can't hear now. We had to mute it for this, so the kids can hear exactly what colors they're choosing. I would like to actually put this up for the health fact. I'll fast forward it here. And now what they do is they press on this magic wand button. Come on. No, it's not. The volume's not working. Okay, so what it's saying here is that you wave your phone over the area to place the heart, or sorry, the heart, the apple. And what happens now is for the first time, the kid is going to see that apple show up in their room the way they colored it. So it's a great pride of ownership, and it's something they created. But before they can play with the app or with the character, they're served up a health tip. Now, this would be read in voice, but we have it muted because of the feedback. But they would hear now this health tip. Did you know apples have been found to be good for your brain health? At that point, they hit OK, and now they can interact with the character that they created, and they can use these buttons you see on the bottom to shoot video or photos to share with their family, who can then share it on social media to extend that message. Puzzle Playground. Like in ColorQuest, the next release in our healthcare app suite is Puzzle Playground, which gives us another opportunity to educate children about the benefits of health through fun puzzles. Here's a quick demo. Actually, sorry about that. I skipped ahead. At the end of ColorQuest, there is actually a bonus game for ColorQuest. And the reason we wanted to do this is we have the children now a bit familiar with their organs, but we didn't want them to go through life thinking that their organs had googly eyes and high tops. So what we do here for the first time is we created this match game that allows them to drag the cartoon organs into the proper place on the body. And then when they tap on that organ, for the first time, they'll see a more realistic version. This is rotated. There's also health tips that they have to click on, and this will be read to them. In order to get a green check mark, and when they read both health tips, for the first time ever, we'll go back, the organ will be placed back into the body, but now not as a cartoon. And there you see it there. Once they're done, they receive a badge, and they become Magic Health Master. I'll now play the Puzzle Playground video. No, or not. We're going to move on to the next. Okay. So with the addition of augmented reality, we can increase engagement and make education more impactful. As we move forward, new features are being added to these apps. All are designed to engage and educate children as it relates to their health and lifestyle. The other way we can continue to engage and encourage users is through our program that rewards users for their achievements in managing their own health. I'll now turn it over to Paul Ring, who's been driving this effort.
Thanks, Iggy. Really excited to be here. Amazing technology. First, let me give some background on the relationship between Stay Healthy and the most powerful entertainment company in the world, Universal. Healthcare is not only about economics, it's about culture. Artists are natural leaders for different generations, and thinking about that, John and I had a vision several years ago that music and entertainment would work well if they could be integrated with health and wellness. So together we presented this concept and what Stay Healthy was planning to launch to the senior management at Universal, and they were all in. Having been at Universal for the past 23 years, I can firmly attest to the fact that Universal's marketing team is constantly looking for ways to engage music fans on a deeper level. Being part of a health initiative where a celebrity artist can let their fans know that they care about their fans' health and wellness will go a long way deepening and ensuring a long-lasting relationship with their fans. Universal is also aware that most artists have either had a health issue impact them directly, their families, or their fans. Many are devoted to causes, and many also have charitable foundations or support nonprofits in the health space. The only thing that they recognize is the relationship between music and healthcare. I'm sorry, the other thing that they recognize is the relationship between music and healthcare. It's been known for a long time that music is associated with relaxation and can help with pain management and stress release, and music favorably impacts health outcomes. So we were thrilled when Universal agreed with us about how important music is to healthcare and offered their top artists from a wide variety of genres, from country to Latin. Universal artists will now be featured within the Stay Healthy apps and offer special rewards for users that can't be easily purchased. Examples are signed merchandise, autographed guitars, collector box sets, and these rewards are earned by those who use the Stay Healthy apps. The celebrity will also send a thank you email for using the app and will feature an upcoming Artist of the Month. So the first campaign we're rolling out is Color Quest. We're working on a new technology that allows people to donate to charities when they are using Stay Healthy apps. With this relationship in place, we are rolling out a purpose-driven campaign where downloading, using, and sharing the Color Quest app as previously seen will simultaneously donate money from a sponsor to a charitable organization of their choice. This makes it all frictionless and eliminates people having to sign up with their banking info and using their own money. This also allows the sponsor to get positive recognition from each consumer that is using the Stay Healthy app. They can also connect to thank users for downloading and using the app and to let them know their action has created the donation. Our debut campaign will feature Universal Music Group recording artist Shanice, who you will hear from shortly. Shanice has sold over 10 million records, and with her husband, comedian Flex Alexander, had the #1 show on Oprah's cable network several years back. This kind of celebrity campaign will be implemented on an ongoing basis where we bring together the Stay Healthy app, the music, artist, celebrity, and connect with a health initiative that is near and dear to them. Shanice did a video for us, special for this presentation, and let's take a look at it now.
Hi, I'm Shanice, and I'm proud to support Stay Healthy and USHC's Healthy Law to help people learn how to live healthier, happy lives. First of all, I just want to say health is wealth. For me, I'm a recording artist, so, you want to stay healthy, even, on the inside and the outside, so that's why it's important for me, for what I do. And just for my everyday life, I have kids, so I want to be a great role model to my children. And with working out, it doesn't have to be a chore. Like, you just find something fun, because some people don't like working out because they're like, oh, it's hard. And, you just got to keep it fun and exciting, and, and you'll see the results. I think eating healthy affects your mood. And the reason why I say that is because if you're eating a bunch of pizzas and heavy foods and, stuff that's not good for you, it will make you feel just like sluggish and tired, and you just want to sleep all day. But when you eat healthy, you have more energy, you can think clearly, So I think it affects your mood in that way. I love the Color Quest app. I mean, I'm like a big kid, so I feel like it's super cool that you can color in the vegetables and then actually see it in the room. And I couldn't put it down. I was like a big kid, like moving around in the room and just seeing the vegetables dance. And so it's really cool because it's in different parts of the body, like the heart and the lungs, and you just learn so much. And it's a fun way for kids to learn. With this rewards program, folks who join the movement can get new music from artists like me, just for staying healthy.
Well, I'm sorry that it was out of sync. Shanice and all the artists at Universal are really passionate about working with us at Stay Healthy. Hopefully you could get a little bit out of that. Gavin, back to you.
Yeah, that was great, and thank you guys. That was really cool. with the power of technology, we'll be able to edit that for our podcast. So no worries on that. So that being said, I just want to see there's a number of questions that came across the wire here, and I'm just going to go ahead and pose them to you. So the first question is, how does USHC and Stay Healthy? Hey, could you guys mute, please? I'm getting a little feedback. So the first question is, how does Stay Healthy and USHC? Still got some feedback.
It's not on. Sorry, it's not on our end. We heard it as well through ourselves. What do you know? Who else is on the line?
Yeah, no, Gavin, you should be able to mute everyone else except yourself at this point as the organizer.
Yep, I'm doing it. Okay. So, again, just a first question here. How does USHC and the Stay Healthy app work together? And the Stay Healthy app is integrated into the U.S. Health Center PhD, which of course is available as an app, as well as, there we go. Still can't seem to mute everybody here. Anyways. So right now the U.S. Health Center Personal Health Dashboard connects directly to the Stay Healthy app. There are a number of our clients that have already adopted the program, and so that connection is seamless. And those organizations that want to engage with it, obviously, will be marketing and bringing that to them. And as the organizations get more and more closer together technologically, as new products are released, we'll be working closer and closer technologically in that regard. So that's kind of where it stands right now as far as USHC goes. John, could you address a couple of the other questions? One is, how can we use the apps? Of course, I just addressed it if you're a US Health Center client, but what if you're not?
They're both available right now in the Apple and Android app stores. One is ColorQuest AR, and the other one is BFI by Stay Healthy. Anyone has any inquiries, they should send them to USHC or to Stay Healthy, and we'll send you the links.
Okay, cool. And how are they paid for?
I think you need to answer that when it comes to USHC. Otherwise, it will be done through as part of the download of the app.
Right. So if it's USHC, depending upon the relationship, it's either a covered, included solution, or it's something that can be a buy-up. And if it's on the open market, you can find it in the App Store or on the Android Play Store. Is that correct, John?
Yes.
Okay. That's the bulk of the questions. There were some couple different derivatives of it, but that pretty much concludes our show for today. I'm happy to say that even though we had a number of different speakers on the line, we concluded on time. Thanks so very much to Governor Thompson for his commitment to our organizations, and of course his mission has become a personal driver of him. And thanks so much to Stay Healthy staff and to Shanice for engracing us with a great show today. So we'll be editing and recording this and sending it out to those that are interested and might have missed it. So thanks so very much. And with that, I'm gonna conclude our broadcast. So have a great day, everybody. Thank you so much.
Thank you. Thank you, everybody.
Oh, thanks, Governor.